Good morning. Thank you, Rep. Gray, for hosting us and for your leadership on this important issue. I'm Kelly Morrison. I represent Minnesota's 3rd District, and I've had the honor and privilege of caring for patients in Minnesota as an OBGYN for more than 20 years. And I think about my patients every single day that I am here in Congress. And wow, I've had a lot of reasons to think about them even more this year. Because what Republicans have done with their total majority control of the United States government is to put health care out of reach for as many people as possible. For making the single largest cut to health care in our nation's history with their cruelly named One Big Beautiful Bill, to kicking millions of Americans off their health insurance, to now jacking health insurance premiums for tens of millions of Americans across the country by triple digits, literally as much as 218% by some estimates. This is their health care plan in action. This is Trump care. Less access to care, less affordable care, more chaos and confusion. And as a doctor, I have to tell you, I find this unconscionable. Taking away people's health care, gutting Medicaid, skyrocketing premiums, pricing families out of coverage. These are horrible policies, and they also have extremely dangerous ripple effects that will affect all of us. I've spent a lot of time this year meeting with patients, healthcare providers, hospitals, clinics, and they're saying the same thing we're hearing from everyone across the country. They are terrified. What the Republicans have done with their One Big Beautiful Bill will mean that hospitals and clinics will be forced to close. Others will be forced to reduce services. And what I always remind people is, it doesn't matter if you have Medicaid or not. The Republicans' cuts to health care will affect you. They will hurt you too. It will hurt everyone, because it doesn't matter what insurance you have if your local hospital or clinic no longer exists. And the Republicans' health care plan will force families to lose their health care coverage, which means those families will seek less care. They won't be able to afford their medications. Even if you don't personally lose your health insurance, increased uninsured rates will hurt you too, because it'll mean a spike of ER visits and longer wait times. It'll mean more uncompensated care and more unworkable burdens on our hospitals. This will only make our country sicker and worse off. And just to take a step back, making more people in our country uninsured, what are we doing? What are we doing? Nobody wants this. The only reason we're in this position is because Republicans chose to give tax cuts to the wealthiest among us and large corporations over Americans' health care. It's unconscionable. It's frankly immoral. That's why I'm standing here with my colleagues, with my patients always on my mind, demanding that we reverse these devastating cuts to Medicaid and permanently extend the Affordable Care Act premium tax credits. That's what the Protecting Healthcare and Lowering Costs Act of 2025 does. It's honestly the bare minimum of what we should be doing in Congress to address the healthcare affordability and accessibility crisis in our country. Democrats were united in opposing these cuts in the first place. And now we call on every Republican to listen to what patients, healthcare providers, hospitals, and clinics across this country are saying and deliver for the American people. This should be a no-brainer. It's what the American people need and deserve. They must do the right thing and put the American people's health first. Thank you.